Hi everybody, this is Dr. Ravindran Kumeran from Apollo First Med Hospitals in Kilpauk. In today's topic, we're going to talk about the emergencies which can happen in the small intestine. So small intestine is the part which connects the stomach to the large intestine. It can be very variable in length. It can vary from 4 meters to 9 meters sometimes. So it's an extremely long organ which is almost replica to a hose pipe. It can be at random, right? And as I said, hose pipe where you pass, which you used to sprinkle your plants with. The hose pipe only needs a small partial twist. You don't have enough water coming on the other end. Same way, the intestine, even if there's a small twist in the intestine, the whole passage gets blocked, right? So you can have very simple triggers for an emergency in the small intestine, often presenting with cramping, abdominal pain and vomiting, right? So depending upon which part of the intestine is twisted, the symptoms can be very variable. If you have the lowermost bit of your small intestine which is blocked, then the patient presents with progressive abdominal bloating, and vomiting may be the last feature. So pain will be there, tummy will bloat up, but vomiting will be a relatively last feature. If you have the intestine which is very close to the the stomach which is blocked, then the patients have immediate vomiting. So the symptoms can be sometimes variable, and because of this variability, small intestine obstructions can be late to present in hospital and can be sometimes misdiagnosed as food poisoning. Often, people would dismiss it as, because of last evening's meal and so on and so forth, which causes delay in diagnosing the problem. So what causes these blockages? Often small intestine blockages are because of extrinsic factors. So it is not because always there is growth within the small intestine which is causing the block. It is possibly because the small intestine is caught up with something else and the blockage is from the outside. That is the trigger of the small intestine. So for example, if you have a hernia and the small intestine goes and gets stuck within the hernial sac, that is an emergency. Now there is no problem within the small intestine. It is because of the hernia causing compression from the outside which is causing the problem. You can have scar tissue. All of us have scar tissue in the abdomen, especially if you've had any form of surgery in the abdomen that gives rise to scar tissue. Scar tissues at random can cause twists in the small intestine, which again is an extrinsic factor. Rarely you can have intrinsic factors, meaning things which are happening within the small intestine which can cause the blockages, such as any tumor, even though they are a relatively rare entity. Small intestine blockages can, over a period of time lasting several hours or days, can progress to a segment of small intestine becoming dead. So there is a limit to how much the small intestine can dilate because of the blockage. So when there is a blockage, even if we don't eat and drink anything at all, there are so many organs which are continuously producing fluids, juices, various enzymatic juices, digestive juices, which keep accumulating. So on an average, a human being has something like 7 liters of fluid secreted into the intestinal tract, starting from the saliva downwards. So all of this fluid will tend to accumulate. So patients often wonder why they are vomiting when they have not had anything to eat or drink. That is because we are all the time producing fluid. So people can become very dehydrated, can have what we call as third space loss, where lot of fluid is sucked into the small intestine, and people can have kidney shutdowns. People can become extremely dehydrated and present to the hospital very late, often septic, because the intestine, when it starts dilating beyond a point, loses its blood supply, can die. If the intestine dies and if it is missed for any length of time, patients do become extremely sick. And again, the vulnerable groups, the very young ones and the elderly ones, are often the ones which are most at risk because of this problem. So anything which is unusual, anything which is causing severe pain and not resolving straight away, requires expert advice, preferably in a hospital setting. Thank you.